Today I would be discussing gender and sexuality differences and why there is differences in healthcare system when it comes to different gender and sexual identities and what are the possible reasons. Starting with breaking the binary, diversity of human sexuality and sexual orientation. First, we have the gender identity. What is gender identity? It is the inner sense of self. If you are man, women, both, or neither. And there are many terms that exist, for example, women, men, genderqueer, etc. Then we have gender expression. This is the outward presentation of gender, for example, what your behavior is and your style and the type of clothes that you wear, and how others may perceive someone's gender. Names and pronouns can reflect this expression. Then we have biological sex. For instance, biological characteristics like genitals, hormones, and chromosomes. One can be female or male, and there can be intersex traits combined variations. And birth assignment may not match the identity. Sexual orientation is the last one that I would be talking about. Sexual orientation is someone who is physically, romantically, and emotionally attracted to. They can be straight, gay, lesbian, bisexual, etc. And sexual orientation is about attraction and not gender identity. When we think about sexual orientation, what probably comes to mind for most people are the three listed acronyms LGBT. That's lesbian, gay, and bisexual. And the T stands for transgender, which is a gender identity. It is not sexual orientation. Some might even think of the Q at the end of the acronym, which is most often stand for queer. The straight sign at the end is the sexual orientation that gets the most play in television and media. But there are so many more ways someone can identify their sexual orientation better than the little acronym here, and it's time that we start talking about them too. Here are several sexual orientations, each with a brief explanation you can see at the bottom, to increase awareness. Keep in mind that this isn't a be all and all list, as after all, language and sexual orientation is constantly evolving. We have homosexual, male and female, identified as gay and lesbians, bisexual, pansexual, omnisexual, polysexual, asexual, object sexuality, and a demisexual. Now we would be discussing the reasons for the bias that we have in the healthcare system with respect to the gender identities and sexual orientations that we have discussed previously. The healthcare outcomes, they differ by gender due to the biological, psychological, and social factors. Why there is gender bias? The gender bias in healthcare system arises from a mix of stereotypes, social norms, and structural inequalities. For instance, women's symptoms, especially subjective ones like fatigue and pain, which is a part of my study that I have done, are often underestimated because providers rely on visible cues and hold stereotypes that women exaggerate symptoms, while men are more stoic. Like they do not tell their pain, and when they do so, they need to be taken care of immediately, or it has to be something serious. Historically, women's physical symptoms have been reframed as psychological, leading many women to feel dismissed or not believed. Social expectation also pressure women to appear composed or positive, causing their distress to be maxed and further underestimated. For transgender and gender diverse youth, bias commonly stems from provider knowledge gaps, including misgendering, incorrect pronoun use, and limited understanding of gender affirming care. These experiences combined with minority stress and stigma reduce trust and lead to healthcare avoidance. Overall, healthcare system often mirror broader societal inequalities, resulting in women and TGD, which is transgender and diverse individuals, symptoms being taken less seriously and their care needs being inadequately addressed. I'm going to be addressing all of them one by one. The first one is the biological factor. The factor is one of the factors with which the differences are seen. The first reason for biological difference could be, according to one of my studies, is that women report high level of persistent fatigue than men, which may relate to differences in hormonal, metabolic, and chronic illnesses, etc. But hormonal differences can influence the symptoms presentation and disease risk in women. However, medication treatment may affect men and women differently, but medical research often underrepresents women, leading to gaps in knowledge. As you can see over here, that of the 86 prescription drugs evaluated, 95% lack necessary dosage adjustments based on sex, leading to a higher rate of adverse reactions in women. As you can see here in the cartoon, the doctor goes saying to the patient, the female patient, we have studies of fruit flies, mice, hamsters, frogs, and monkeys in men with this condition, but medical research using women as subjects just never occurred to anybody. Then we have biological variations which may shape symptoms presentation, but bias arises when providers misinterpret or overlook these differences. They just try to mask it or just try to be like they're not understanding or it's just not that serious. Some transgender youth, for example, assigned females at birth, individuals using menstrual suppressions experience health needs specific to their sex, assigned at birth and transition-related care, but 22% of them stopped seeking treatment for their condition due to medical gaslighting. This model is related to my study. The diagram shows it's a mediation model of gender and fatigue perception bias. I'm going to try to explain it as easy as possible. You can see expressiveness and attentiveness at the top, and then fatigue perception bias and target gender. You can see the diagram shows the target gender influences how expressive, attentive a person appears. And this expressiveness then affects the perception of fatigue bias. Now, what that means is when women were more expressive and attentive, they were positive, going towards the positive path. However, actually, yes, and the higher the expressiveness, that led them to less fatigued and negative path. This means that gender differences in nonverbal expressiveness partly explains why women's fatigue is underestimated compared to men's. Then we have the psychological factor as to why there are biases in the system and why there is biases in healthcare system towards sexual orientation and different gender identities. There are stereotypes about women that they complain more and they are less accurate reporters of symptoms. They are more emotional and this influences the provider's judgment. Women and transgender and gender diverse often feel pressure to self-silence or mask negative emotions because when the symptoms appear minimized, they appear to be more emotional or they complain more. This leads to further underestimation. The gender minority stress or TGD youth, the transgender and gender diverse youth, one of the psychological factors that influence their mental health and causes a discrepancy or difference between the healthcare system is the chronic stress from stigma, discrimination, and lack of acceptance. As little as it may sound to the people who actually do it, they say, oh, we did not understand the pronouns, but it actually helps, it actually messes up their mental health. And from that fear, they stop seeing the doctor, which comes to my second point, causing adverse mental health outcomes, anxiety, and depression. The healthcare interactions can worsen psychological stress when provider lacks training or shows bias. This here shows the picture depicts that the fear of not being believed reduces accurate self-reporting in both women and TGD youth. The third one that we have is the social factor of the difference. We have gender norms and socialization. Women are expected to appear positive, expressive, or okay. If not, they're perceived incorrectly. As per the study, if they are not pretending to be okay, they are interpreted as um, non-expressive, showing that they are tired, but they're not tired, or they are not tired and they're showing that they are tired. On the other hand, men are perceived as more stoic. When they show symptoms, they are taken more seriously. This societal pattern of medical dismissal of women's symptom historically is labeled as psychomatic. As you can see in the first picture of the cartoon, the doctor is telling the patient that it's eczema. Have you been under a lot of stress lately? Now she tries to explain her stress by, oh, just the usual work stress, bridal dress, breast cancer stress, and my hospital gown with the side with it. And he goes, oh, I'm sorry, my wife is a psychiatrist at Sloan. If there's anything I can do, let me know. However, in the other pictures, you can see clearly the difference of how men are being treated. The last picture says, based on how good a doctor you are, I bet you wanted to be a physician since you were young. The doctor is like, oh, well, I wanted to be a pirate, but guilty as charged, sir. I never imagined myself anything other than a doctor. I knew it. For LGBTQ and TGD youth, lack of provider education, knowledge gap has created incorrect assumptions, which led to inadequate care of LGBT and TGD community, and past experiences of misgendering and discrimination reduces the trust in healthcare institutions and led to avoidance of care in this community. And the social stigma that contributes directly is to the health of these people. Overall, the healthcare system mirrors social and societal biases, producing unequal treatment and poor outcomes for women and LGBTQ and TGD population. As you can see here, that nearly 1 out of 5 people in the LGBTQ plus community avoid seeking medical care due to the fear of discrimination. And from one of the studies of the mental health services that I have read about, the 2/3 of the LGBT plus people, which is about 67% of the population from the studies that have been done, reportedly showed that they needed mental health services, but they never went for it because of the fear of being discriminated. The study shows that about 16% of the LGBT people experienced discrimination in healthcare, and transgender people, they experienced discrimination in healthcare were about 34%. Why? The fear of prejudice and the fact that they don't want to disclose their sexual orientation and gender identity to the healthcare provider made them not go to the provider in the first place. I believe.
Law preference. According to the CDC, about 20.3% of adults received mental health care in 2020, but women were much more likely than men to seek help. The report shows that 25.6% of women received mental health treatment in the past year, while only 14.6% of men did, meaning women accessed care almost twice as often. Women were almost more likely to use prescribed medication and attend counseling. These differences reflect not only higher report rates of anxiety and depression among women, but also greater comfort with asking for help, while men are less likely to seek professional mental health support. Rule of intersectionality. Gender differences in mental health care do not look the same for everyone. An intersectional perspective shows that gender interacts with race, cultural age, and access to healthcare to shape how people experience and seek mental health support. Research by Gimli et al. Highlights how factors such as racism, cultural stigma, language barrier, and insurance access can limit care for certain groups. As a result, individuals from different racial and cultural backgrounds, such as a Black woman, Asian men, or Hispanic adults, may experience mental health concerns differently and face unique barriers to seeking help. Vary by gender, sexuality, and age race. Men and women show different mental health patterns, but these differences also depend on sexuality, age, and race. Latina and Asian women may show stress through physical symptoms. Gay and bisexual men seek help more than heterosexual men but face more discrimination. Younger adults express emotions more openly while older adults often hide them. White adults get treatment more often than Black, Hispanic, or Asian adults because of stigma and mistrust. This shows mental health behavior is shaped by many identities, not just gender. Potential ways to decrease any gender sexuality gaps. Ways are increasing mental health education for all genders, reduce stigma around men seeking help, provide LGBTQ plus inclusive counseling service, training professional in gender sensitive care, offer support group designed for different identities. One interesting finding is that when symptoms don't match gender stereotype, clinicians often misdiagnose them. For example, depression in men is frequently missed because irritability is mistaken for personality or stress. Meanwhile, digital mental health tools like apps reduce stigma and make help seeking easier for all genders. This page is our references.